Hello, everybody, and welcome back to PT Outcast. I am thrilled to join you today with a new friend, Dr. Jane Lucas, who I recently met at the American Academy of Orthopedic Manual Physical Therapists Conference this past October in Orlando. And I met Jane. She had just gotten her fellowship and was awarded her fellowship certification status. Yeah, there it is, right on the wall. And so I went and made friends with Jane, and I was thrilled to discover that she's practicing in India, and we've had some conversations after that, and I think everything about this is fascinating. So I'm learning so much speaking with her about how practice in India is different than the United States, and I think it's really wonderful to understand the texture of how it differs from us. And so I think we're in for a good conversation today to talk about physical therapy in India. So Jane, welcome to PT Outcast. Thrilled to have you. And maybe we can start off by telling everybody a little bit about your background and what you're doing and how you got to India.
Sure. Well, as you said, I'm currently living and practicing in New Delhi, India. I started my physical therapy career at Medical University of South Carolina. I graduated in 2013. And immediately after I graduated from MUSC, I started a residency with the Institute of Physical Art. So I immediately went into manual therapy. After I completed my residency, I achieved my CFMT, so that's a Certified Functional Manual Therapist certification. And I was at a clinic in Richmond, Virginia, and I immediately started working and training the next residents. And I discovered that I just loved mentorship. And it was during that time that I was working with the residents that the founder of a clinic in New Delhi reached out to me. And they were looking for somebody to come to India to teach and train physiotherapists in New Delhi. And it happened really fast. We had an interview, and I think 2 weeks later, I was in New Delhi. It was all really, really fast. And I was supposed to be here for 4 months. And 7 years later, I'm still here. So obviously I loved it, but it was a whirlwind. It was also very shocking. In a lot of ways, I think that the United States and India are almost polar opposites. Things that are very challenging in the United States are incredibly easy in India, and vice versa. There was a brief moment where I lost my visa in India during COVID. So I was in the United States, and India closed down their borders for travel. Only people with Indian citizenship were allowed to come into India or fly in and out of India. And since I did not have citizenship, I was not allowed to come back. So that was when I decided to do a fellowship. So I did an AAMT accredited fellowship. And when I finished that, I returned to India and eventually left the clinic, went out on my own. And here we are today, practicing independently in my own clinic in New Delhi.
So in 2 weeks, you went from I'm going to work in Virginia to I'm going to work in New Delhi.
That's right. I should say I had already left my job, so I did not give them 2 weeks notice. I gave them 3 months notice.
Fair. Yeah, I wasn't going to judge you on that part, but yeah, more about the sudden shift. Yeah.
But my plan was to move to be closer to my family in South Carolina, and then I all of a sudden was in India.
Yeah, so failure, but new adventure, right? So
I'm also a success, right?
So, I'm very fascinated in how physical therapist practice is different in India, and this isn't the first time you and I are talking about this. So I just want to kind of let the listeners know, we've had some previous conversations, so I kind of have some ideas about where we're going here. But can you talk a little bit, just broadly, if somebody asks you that question, how is physical therapist practice in India different than the United States? What's your response to that?
It is really different. That is a big question.
Let's start with maybe the, I guess sort of the role of physical therapy in India, right?
Okay.
In the US, it's part of the healthcare infrastructure, and I feel like it might be different in India.
Mm-hmm. Mm-hmm. Absolutely. It is quite different. So here I would say, and of course I'm speaking for myself. It could be different for other physical therapists in India, but I find that when most of the time when patients have come to me, they have seen multiple doctors, and there's such overpopulation in India, such incredible population density here, that when somebody goes to the doctor, by 10 o'clock, that hospital has probably 100 people in the waiting room. So when you get in to see the physician, they maybe spend 3 minutes with you if you're lucky. So you're getting a quick diagnosis. So a lot of people aren't sure if they trust the diagnosis that they get. They'll go to multiple doctors, multiple orthos, and they'll, because these things are very affordable. Going to the doctor is very affordable, even if you're just paying out of pocket. Getting an MRI is very affordable. So they get MRIs of everything. If you have any sort of neuro symptoms, you're probably getting an MRI of the entire spine, brain. I mean, so many x-rays. People come in with bags and bags of imaging before they come to me. So when they come to me, they've seen multiple doctors, they have all this imaging, and they still don't have a diagnosis, or they're still not sure what's going on with them. And of course, as a physical therapist, of course, my own private practice where I give all of my patients an hour, I spend a full hour with them, and I give them a very comprehensive evaluation. I look through all of their blood work, all of their imaging, and then I'm able to tie it all together and talk about their diagnosis and treatment plan. But a lot of my patients, when they come to me, it's the first time they feel like they really understand what's going on with them. And I'm not blaming anyone else, because they just don't have the time to spend an hour with all of their patients, doctors or other clinicians. But I think a lot of patients here have a dependency on the physical therapists for that, because we end up being the ones to read their MRIs to them, or their blood work, or all of these things. A lot of times I pull out their MRI and no one has even showed them their MRI, and their MRI could potentially be the reason for their symptoms. I'm not saying that it always is, but when it is, a lot of times they've never even seen their own MRI. No one's ever even explained it to them. So I think there is the relationship between the physical therapist and their patient here is different. Maybe what they depend on us for is different.
Okay, so it's a more of a primary care role in a sense, like a supplement to primary care in maybe a bigger way. To me, it almost sounds like a little bit of like rural health, where you might be catching a big swath of patient diagnoses and having to handle all sorts of things. So do you see, like, would you say you see a broader range of, or a different range of diagnoses practicing in India?
It's completely different because the environment is different. One of my patients said to me last week, he said that clean air and clean water are luxuries. So because Delhi is the number one most polluted city in the world, right?
The number one most polluted city in the world.
Yes. Yeah.
Yeah. So you're seeing things related to environmental illness, right? Like respiratory problems.
Respiratory problems, sinus problems, even rib, thoracic restrictions, just related to. They say that on an average day in New Delhi, it's the equivalent of smoking 47 cigarettes per day.
That's stunning.
Yeah.
Are you concerned for your own health there?
I definitely was. My personal flat is a 3-bedroom flat, and I have 4 air purifiers.
Okay, so you're taking some precautions there inside, but I would maybe consider that you're the exception for having these things. So hopefully you're not having 47 cigarettes today, and maybe you're having the equivalent of 4. Right.
And those N95 masks that people wore during COVID, when I go out in public, I wear 2 of them. So it's you have to. Life looks very different here, but it definitely affects patients. I'd say the average person over the age of 20 will have some rib and thoracic restrictions. I think it's very common for people to start having some issues with sleep apnea much younger. And I do an intranasal treatment where I go into the nasal cavities and I treat the turbinates and I treat the opening to the nasal cavity. and I'll treat it in India, and 3 days later, again, it's like I never treated it. You can feel that it's inflamed, and it's just the intensity of the pollution here. When I used to treat it in the United States, I might treat a patient 2-3 times, and I would never need to see them again, ever. Because the pollution, the AQI, the air quality index in the United States, is typically between 0 and 50, right? When it's over 100 in California, they close schools, right?
Right. I remember when there was wildfires, it would get over 100 and we'd start seeing the warnings and the maps. Yeah.
Right. In New Delhi, 100 would be a good day, right? They don't close schools in New Delhi until it's 400.
Okay.
After Diwali, our largest holiday, just recently, it was 1,700. The air quality was 1,700.
That seems hard to understand. That's blowing my mind because I was in Northern California back in, I don't know, was it 2018? They had the wildfires in Napa and all those NorCal wildfires, which were just incredible. And I remember there was a day that the air quality index was like 440 or close to 500.
Mm-hmm.
And I was afraid to look outside, let alone go outside.
Yeah.
1,000 just makes no sense to me.
You can try to look outside, but you'll barely see across the street. You won't see much.
Yeah. So is there a difference in life expectancy because of this? I would assume there is, right? So are you seeing patients with a lot more like chronicity and more like COPD as like a standard presentation?
Right. There are issues with that. I've also had patients who had lung cancer who did not have a history of smoking. And of course, doctor said that was related to the air pollution. So it is.
There's also some cultural things. You were telling me a story about a woman who has some cervical issues who maybe needed an MRI, maybe didn't, but couldn't get one. Could you tell us a little bit about that? I think that's a fascinating cultural story.
Sure, absolutely. Yeah. So I think understanding this is also understanding the importance of marriage and family. So the role of the husband and the role of the wife. And in a traditional Indian family, women very oftentimes are stay-at-home moms and wives, and it's this responsibility that you have to your family. And that when you get married, and oftentimes it is still an arranged marriage, that you take on this responsibility of exactly what it means to be a good wife and a good mom. And this is often represented by in a traditional Hindu wedding. They will place this necklace on the woman. It's called a Mangalsutra, and oftentimes they're quite simple. They're just gold with little black beads, and it represents the marriage. But the more status you have, the more gold. And so I was treating this woman who was in her 60s and had cervical radiculopathies into both upper extremities, significant neck pain, and incredibly stiff thoracic spine. And when you feel her neck, you can just feel the osteophytes and that there must be significant degeneration. And she had this massive Mangalasutra, long and lots and lots and lots of gold. Most people said it weighed at least 1-2 kilos. It was incredibly heavy. And the neck is just not designed to take that kind of weight. And so when I first met her and I saw this and she was coming to me for neck pain and radiculopathy symptoms, I went to her. She had a team of doctors on her staff. And I met with them and I said, is there something that we can do about the weight of this? It's not natural to have this kind of weight on the neck. And they were like, it's not even, there's no point in even talking to her about it because this symbolizes her commitment to her marriage. And so she will never take it off. She will never do anything that compromises this symbol of her commitment. And so that includes getting an MRI. Even though we all have an idea of what her neck would probably look like on an MRI, she has MRIs of other body parts, but she'll never have a cervical MRI because she will never take her necklace off because of what that would mean towards her family. So I thought it was really powerful.
Yeah, fascinating.
To a family, and also what that can potentially do to your body is just so different from anything you'd see in the US.
Yeah, just like a kind of a cultural mark. I thought it was a really interesting story. Thanks for sharing that. Um, I guess another thing, you were showing me some photos of you doing some different physical therapy work, and you made a comment about the street
Yeah,
and how difficult it is to walk or just to ambulate on the street. So that's another really interesting thing. Can you share a little bit more about that?
absolutely. Yeah. So most cities in India are not walkable. And even though parts of the US may not be walkable, I'd say most cities have an area that is. You might go to downtown and you have sidewalks, or maybe you come home after work and you can walk through your subdivision, right? Something like that. So people have access to just being able to take a walk. And you really can't walk here. Even if I were just to walk to the end of my street, it's going to be difficult. It's highly congested and the
What
road
makes it difficult? Congested is and the ground, is the ground uneven?
the ground is very broken, but and also, I mean, it is incredibly congested. It's more of a crowd than you can ever imagine. Just for scale, Delhi is 26 million people, right? New York City is the largest city in the United States and it's 8 million, right? So our the city I live in is more than 3 times larger than the largest city in the USA. So congestion sometimes means I have had roads where I couldn't fit my body down the road because it was so congested with cars and people. And I had to turn around and find a different route because I literally just couldn't even fit down the road. So it can be incredibly congested.
Okay.
But then the roads are also very broken. Just and cars drive both ways, buses drive both ways, motorcycles will drive on the sidewalk. So it's really not even safe to be on the sidewalk because I've had motorcycles, coming directly at me on the sidewalk. So it is very challenging. And you'll have patients who say something like they just want to be able to walk to the market. Every neighborhood has their own little local market where you can buy fabrics or basic household goods or vegetables, right? And a lot of women will just want to be able to walk to the market. And if they have knee pain, or you can imagine like decreased balance, maybe especially stroke patients, things like that, it can be really challenging to navigate the crowds and the uneven terrain just to walk to the end of the block to get your vegetables.
Yeah, I guess it makes me wonder. I don't know if you've thought about this or not, but that we have sort of traditional measures of balance and static and dynamic stability. I mean, are those things valid, or is there a different interpretation of them in India if the demand for your dynamic stability is very different? Like maybe there's different benchmark for what's community functional ambulation.
Right. Actually, that's a really good point. Right. It would be completely different here. And I will also say the assistive devices that we use in the US are not accepted here. This is culturally, socially not accepted. So you won't see
So yeah, talk about that. What's not accepted?
really, there is a pressure to sort of look like everyone else. And not in a bad way. This is just what's socially acceptable. So um, you would never want to go out and draw attention to yourself, especially something that would make you look disabled, like a cane or a walker. So if you go out in public, you'll never see people using canes and walkers or wheelchairs. I mean, that would be in this fantasy world where New Delhi was, handicap friendly and we had an ADA or something like that. Even if we had all those things, people wouldn't use wheelchairs and walkers and canes. Um, the closest that you'll get is they will hire somebody to hold their hand. So they might have a person on their staff,
A stability person.
right? A person on their
So
staff.
an assistive Homo sapien.
There we go. There we go. That's right.
Wow, that's an you're just yeah, okay.
I remember the
Um,
first time I heard a patient tell me this, where they said they weren't willing to use a cane, but they were willing to hire someone full time to hold their hand and walk with them around the house. And it just blew my mind as an American to imagine hiring somebody full time on as your staff instead of just buying a cane or a front wheel walker. It's just
yeah, and you're talking to probably somebody like in an upper caste, right? Somebody who has a lot of wealth, but people who don't have that. A, do you see those people?
so.
And B, what would they do?
right. So there is no minimum wage here, but also the cost of living is quite low. So when I first moved here and I found out some of these salaries, these monthly salaries are incredibly low, and honestly, anyone can afford them. Anyone middle class or upper class can afford them. And I felt conflicted about people making so little. However, you can actually afford life with these kind of wages, right? Because the cost of eating out, if you're depending on where you're eating, is also quite low. The cost of your vegetables is quite low. You have subsidized healthcare. Our medications are a fraction of a cost of U.S. medications. My mom came here to visit me in 2019. She bought 6 months of her heart medication. I think it was $4 or $5.
Whoa. So, India, is it technically classified as a developing country? It's sort of weird though, right? Because it's also a really substantial country. So it kind of fits like developing and already developed. It's a weird mix, right?
Right, right. I would say developing because they don't have access to the same things that are in the United States, and also the infrastructure is not the same as the United States or other developed countries.
Right. The very first time you and I tried to meet, there was no internet for like the city or something, right?
Right, power outages. Right, we get power outages every day, and um, something happened to me recently where I just didn't have water for the day. And so you just try to figure it out. But, during that day, you can't wash your dishes or take a shower or flush your toilet, because you just don't have water that day.
Okay, yeah. So some inconveniences that would really kind of upset us, kind of the standard flow over there. Okay.
Right.
So I have another question, and I'm not sure if you have the perspective to answer this or not, but I'm curious about your perspective here and what you're describing about how you treat patients for an hour and you work through their diagnosis. You're a physical therapist trained in the United States, so I would assume then it's reasonable to assume you're providing a United States style of physical therapy in India. How does traditional physical therapy work in India, or like how would physical therapy practice look from somebody who trained in India and that was their worldview?
Good question. I'd say up until recently, physical therapists were kind of viewed as um, people who couldn't get into a better field. Like if you couldn't get into medicine, then you went into physical therapy. And so I think that also affected how they were treated. So a lot of physios here were hired without ever being expected to use their clinical reasoning. They were hired by a hospital or by a clinic or by a doctor, and the doctor basically just told them what to do. And unfortunately, a lot of times that's modalities. So when I tell patients in India that I don't have modalities in my clinic, their first response is, well, then I don't understand what you do. Because a lot of people, their only interaction with physios here has been modalities. They've never seen them do anything but ultrasound and e-stim, and that's it. Which is
Yeah,
wild.
I asked my AI Claude to tell me a little bit about the differences as I was preparing for this podcast, and that was one of the things it told me was that e-stim is a primary treatment for traditional physical therapy. Yeah.
For everything. So it's wild. Yeah.
So there's this training gap then, right? So if you're trained in India and this is sort of what you're thinking, how do you make that leap to use something like manual therapy?
Right. So their access to continuing education is not the same as what's offered in the United States or even other countries. There are short, abbreviated continuing education courses. The entire course, start to finish, for a longer course might be 5 days, and that would be the entire program. So you won't find residencies and fellowships; those don't really exist here. And if a company was marketing a residency, it would again be one of these very short programs, not these longer residencies and fellowships that we do where you have mentorship and you have somebody co-treating your patients with you and doing in-services at your clinic with you, and all of these things, and that doesn't even include the multiple continuing education companies that we have access to, the IPA, Baral, so many different manual therapy organizations. So when people do manual therapy, I think it's difficult for them to be able to become trained to have the same skills that somebody could potentially have in the US just because they don't have access to the same opportunities.
Is there a difference in acceptance of manual therapy in terms of patients? So a patient comes in and their worldview is their previous experiences with physical therapists from India, and then they meet you and they meet your clinic, and it's different. How does that react? Are they like, "Well, where's my e-stim?" Or are they like, "Whoa, this is cool"? Like, what's the response?
Right. It is usually a pretty fun first session. My first session with somebody that I've never met before is always my favorite. I think a lot of us, the evaluation is the most fun, problem solving and clinical reasoning and getting to know a new patient. And it is really exciting, but also the patient's response, like you said. So uh, I can't even tell you how many people say things like, I've never been evaluated like this ever before in my life. And I've had physio from a number of physios and seen however many orthos, or I feel like somebody understands me for the first time. And of course, this has nothing to do with me. I had amazing mentorship. I'm very grateful for my residency and for my fellowship and for MUSC that I went to. I think we all know that quote, but if I've seen further than others, it is by standing on the shoulders of giants. Right? I've had some
Great. Yeah.
wonderful mentors, and so my treatments are just a reflection of that. And but I almost always get that response. It would be rare that I don't get that response.
Do you ever have people request modalities?
I think once from what I can think of.
Okay, that's great. I think I've had more people request modalities in the US than that, right?
But also, modalities are so easy. If what somebody really wanted was modalities, they would pay a physio to come to their home and do ultrasound and e-stim, and it would be a fraction of my charges. Right? Because you can get a physio to come and treat you for, I don't know, maybe not come to your home, but there are physios that you might be able to see for something like $6.
$6.
Mm-hmm.
Wow. And earlier you mentioned MRIs are really affordable.
Mm-hmm.
What makes them affordable?
It's really interesting, isn't it? Yeah, you can get an MRI here for about $50.
Wow. So, yeah, developing country, yet healthcare is decidedly more affordable from an accessibility standpoint, but maybe not from a number of resources standpoint.
Right. Now, I mean, I had an MRI for fun after I moved here. Just I'm so used to reading other people's MRIs, and so I just wanted to see my own, And I went to this hospital, and even though most of the experience, it's the same kind of MRI machine, and the MRI looks the same, and everything else is the same. But at the same time, I showed up at the hospital, and I arrived on time for my appointment. But I showed up before everyone else in the hospital. I was the first person there. The lights weren't even on yet. And so even though I came on time a lot of times in India is early because they just have a culture where they show up late. The technician who came in didn't wear any shoes, so the whole experience still felt very Indian. But I was grateful to have an MRI for $50.
Yeah, really kind of interesting. I was looking at the numbers of physical therapists, and I think there's around 88,000 physical therapists registered in India. And I think that's probably comparable to like maybe 250,000 in the US, except the US has, 5-6 times less people than India. So it would, you could argue that there's probably a really big need. There's probably a group of people that will never see a physical therapist in India just because there's not enough of them. What do you think about that?
Right, and also, so I think not all therapy is created equal. If all they're doing is ultrasound and e-stim, there might be a larger need for physiotherapists. I had a patient who came to me recently, and she actually was fairly simple, in my opinion. She had she had an ACL tear and an MCL tear, but she was very strong. She was an athlete, and she had been going to another clinic for several months, and they were only doing strengthening exercises with her, and she was already very strong. And so when I muscle tested her, she really didn't need to do any more strengthening. So within 5 sessions, she had no pain. She could do all of her sports, activities, exercises, everything she wanted to do with no pain. And she was great after that. But there's only so far that she could get at another clinic with just exercises and ultrasound. Right. So maybe there wouldn't be a need for so many physios if also they were the quality of the care was better.
Yeah, I hear what you're saying. So even maybe I see that two ways, right? So maybe physical therapy could be more efficient, but also maybe good physical therapy is even more scarce.
Yeah. Right.
Right.
Right. Exactly. And this is across the board. When I meet physios here, the number one thing that they ask me is, what can they do for continuing education? And the people here, they want to learn more. They want to grow. They can tell that their university got them to a place, but that there's room for improvement. And I think that's how we all feel after we get our physical therapy degree. We all feel,
Sure.
like it's a good starting point, but we're not the best that we're capable of being. And then in the US, you continue to pursue continuing education. You have all of these opportunities. And in India, people are just coming to me and asking me where they can go and what courses they can take and how they can grow.
Are there continuing ed requirements for licensure in India?
No, because you also don't have to continue to register your license.
Okay, so you can operate unlicensed in India. And maybe I won't hold you to the legalese on the answer, but
okay. I know the way I have to renew my license every 2 years in the US, that there is an option to register your license in New Delhi, and but it's optional.
Okay, optional so you have to get a licensure at first, and then re-registering it is optional.
Right, that's what I can tell.
Sure, but your license is different. So if I'm or somebody else listening to the podcast is like, wow, it sounds like there's a really big need for healthcare in India, or for physiotherapists in India, and I want to go practice in India. Do I need to get a license from a state in India or the country, or is my U.S. license good enough?
I was never required to have a comparable license in the United States. And when I came over with a very powerful organization that was running a large physiotherapy center in New Delhi. And so we did everything exactly by the book. I did register my physiotherapy license with their with the physiotherapy. It's called the FRO. So I was properly registered, and so if I needed to get an Indian equivalent, then I would have, because this company did everything exactly right. And it wasn't.
So your U.S. license then is your functional license. They recognize that as the ability to practice physical therapy in India.
Right, because it's from the U.S. They don't recognize licenses from all countries, but they do recognize a U.S. license.
Okay, I feel like we're sitting in privilege here a little bit, right? I feel like we should also just acknowledge that for the whole conversation, right? Like you and I are talking from a position of privilege, and there's probably a lot to talk about that we can't see and we can't understand, because I think as a developing country, there's a spectrum of perspectives, right? And I think we can see one, and so it's probably worth it to just recognize that there's a whole bunch of other perspectives that we might be missing out on in this conversation. And it's one of the things that's been on my mind throughout this conversation is like, what are we not talking about that we should be?
Right. And that is true. When people meet me, because I'm American, the stereotype for an American in India is that Americans are educated, wealthy, well-traveled, and so many things, which I realize is not always the case, but that is how you will be perceived when just being white. But once they find out that you are American, they will make these assumptions about you. And so it could also be that my experience in physical therapy in India is a reflection of me being American, and that potentially Indians don't have the same experience. That could also be the case.
Yeah, certainly. Even your outfit, I want to talk just a little bit about that because, I said to you today, like, wow, like, you're dressed and you seem like you're in India. And so, you talked about your own concerns about cultural appropriation, but not a concern, right?
Right, absolutely. I love this about India. I love a lot of things. I really, really love this country. Even though I know I've said some things that maybe sounded kind of negative, but I really am just in love with this country. So they love it when people come and they enjoy their culture and they want to share their culture with everybody, whether it's the clothes or the jewelry or the food or their language. And so if you come and you wear their clothes, they get so excited. And I was concerned when I first came here that it might be perceived as cultural appropriation because that is kind of a big deal in the US, right? But it's the exact opposite. They just want to share everything with you. And if they find that you like it, it will make their day. You can tell they get so excited. And I've never met a single Indian person who felt otherwise.
Yeah. So just really kind of welcoming, right?
Very
Yeah.
welcoming.
What are the other things that you love about living in India? Like, you've been there for 7 years. You must obviously love it. So yeah, just give us the rundown. What fancies you?
I love this question. This is so easy for me, because people always ask, especially Indian people ask, how can you live here with the pollution and the food poisoning, and there are so many things that they struggle with that they imagine Americans would struggle with. But I would say Indian people here are by far the warmest people I've ever met. I've lived in 10 states in the United States in 5 countries, and it's just dramatically different from any country I've ever been to. If you meet somebody and you get along well and you sort of see eye to eye, you connect. Even if you only meet that person once, 2 times, 3 times, they will immediately invite you to their home. Inviting you to their home means they live with their family, so grandparents, parents, them, maybe brothers and sisters. It's a joint family home is what it's called. And so what they're saying is they're inviting you to come and meet their whole family, and they'll want to cook for you, and it's just amazing. So when I meet people here, I have developed these friendships that are so close with these amazing people, and you'll become so close with somebody in months. Just within a couple of months, you'll have somebody who treats you absolutely like family. Or I joke, they treat me, better than some Americans treat their own family. You know,
Yeah, I feel that.
Right? It's incredible. And I think the most important part of life is the relationships that are in your life. And so to me, India does that better than any other country.
Yeah, well, good. Like, lucky you, right? Good on you. That's a nice place to be, and somewhere you're feeling really comfortable and you find that joy. And also, you could talk about I could hear as you're talking about your practice, there's sort of joy in delivering really high quality care to people maybe who haven't experienced that before.
That's right. That's right.
Yeah, good. So we're sort of getting to the end of our conversation here. So, just I like to end the sessions and say, like, well, what are you working on? Like, what's your thing that you're doing? So I think you have this initiative about some clinics going on. So yeah, talk about what's next for you.
I do. Well, first, we had mentioned physical therapists not having access to the opportunities that we have in the USA. And so, one of my greater visions that I'm really hopeful to see come to India is I would love for IFOMT to have a chapter in India. So I would love for, the way we have AOMPT in the USA, I would love for there to be an Indian manual therapy chapter, because manual therapy is really exploding here. It's becoming increasingly popular all over the country, but manual therapists are not organized. So if we had something like an annual conference where we could all come together and collaborate and share ideas, or publication, or again, access to residencies or fellowships, these things, I think it could make such a dramatic difference in the quality of care provided here. So that's one thing. And then personally, I have my own private clinic that I am looking to expand, and I have been working with different groups of people, and it's not for sure yet, but I am hoping to eventually start a residency program and start training therapists around India to try and promote manual therapy and, again, the same quality of care. And actually, just like this whole clinic model that we have in the USA, the clinics that I worked at in the United States, I was really excited to wake up and go to work in the morning. And when I would talk to my coworkers, they were the same way, because you were always learning. You had a mentor helping you, and you were presenting journal articles, and it was basically a structure where you were always growing, always learning. And it's that sort of structure is so exciting, right? And you never really hit a dead end with your patients, and so you don't burn out. Your difficult patients, you bring your mentor in, and then you co-treat that patient together, and it's actually just a learning opportunity. So I never found that I burned out in those types of clinics. So I would like to see that here, where people are excited to go to work and they're always learning, and patients can sense that, and patients are always improving. So I'm looking forward to implementing that same model here in India.
Yeah, I feel maybe there's a parallel. You talked about the joint family home where the family lives in the home and there's different levels of the family in the home. Maybe you want a joint family home of a clinic, right? So
Clinic.
yeah,
Oh, I like that, Eric. That's
yeah.
great.
All right. Well, well, good. So, thanks for joining us here on the podcast. It was really fascinating to learn more about PT in India, and I think you're doing really noble work, and really, work that's meaningful and in a place that maybe it's not the easiest, but it seems like you've assimilated well. So, congrats to you, and good luck to you. And we're going to close out the podcast now. And thanks for joining us. And it's been another episode of PT Outcast. Talk to you later.